right, everybody. Welcome back to the Modern Day Overthinker podcast. My name is Colin, and I am your host. This episode is with Ashlyn Lelej. She is a speech-language pathologist and owner of Speech Matters. We discuss the scope of speech therapy, including articulation, receptive and expressive language, feeding and swallowing issues, childhood delays, adult recovery after a stroke or brain injury, and neurodivergent conditions such as Parkinson's and ALS. Before I forget, I would like to shout out our lovely sponsor for this episode, which is Soulfire. Soulfire is located in Bettendorf, Iowa. It is a wellness studio built around feeling better physically, mentally, and energetically. They use heat, cold, and light in a space designed to feel elevated, welcoming, and alive. What they offer goes beyond these services. They create very good experiences as well. I have been there. I was able to tour the place, meet the owner, tell them that the funny guy with the podcast sent you. Tell Emily, the owner, I said hello and that she is awesome. This episode also covers sensory integration in feeding, the use of toys like Legos in therapy, rising stroke rates in younger adults, subtle stroke symptoms in women, and the effects of social media and screen time on communication, empathy, and social skills, along with resources for finding qualified speech therapists. So without further ado, let's get into it. Welcome everyone to the Modern Day Overthinker podcast. My name is Colin and I'm your host. This episode is with Ashlyn Lelej, and I said that right, I hope.
Yes, you did. Perfect.
Good. I've been working on it. I've been practicing. It's good to have you here. We're covering a topic that I've never really got to talk about on the podcast, so that's exciting.
Mm-hmm.
I want to start out by just giving you a chance to introduce yourself and let my audience know and listeners know what you do, and then we can kind of get into conversation, and I'm sure I'm going to have a ton of questions. So
Yes. First of all, thanks for having me on.
yeah, absolutely.
Yes. So my name's Ashlyn Lelej, and I'm a speech language pathologist, speech therapist, interchangeable terms. And I am the owner of Speech Matters, which is a small private practice in Charlotte, North Carolina. And we provide speech therapy and occupational therapy to children from birth to adults of all ages. We're primarily pediatric in the clinic, but we do also see adults as well, both in the clinic and through telehealth. So that's kind of the short answer of what we do. So any specific questions you have, I'm sure I can
absolutely
answer those too.
As far as just for the basics,
Yes,
to get people on the right page, because we were talking about earlier before we started recording, I had friends that took speech language pathology, and I was like, I don't even really know what you guys are doing over there.
Right.
I kind of had an idea, but I just wanted to give everybody an idea of what that means and what that, you said there's a lot of avenues you can go with that particular degree, but can we kind of give a little bit of a definition of what that is and what you can do with that degree?
Yes, definitely. So, the speech pathology is a really broad degree. So it works on all different areas of speech and language. So one of those areas is articulation, or the production of speech. How clear do you say your speech sounds? How understandable are you? And then you have language, which can also be further split. So you can split it into working with people who have any issues with receptive language, which is basically understanding, processing information that comes into you. So there's different milestones for different ages with that. So some kids are delayed in their receptive language, their understanding of language. So we would work with that. Some adults would, after a stroke or a traumatic brain injury, would have some issues with receptive language. So we would work to get that back, and back on the age appropriate norms for that. And then you can go to expressive language, which is how you put all your thoughts and organization into words that make sense and are able to kind of express what it is you're trying to get out there into the world. So obviously with kids, you would work on that. There's certain norms for certain ages that you would work on. And then adults, same thing. Sometimes it can be as simple as you have kind of some delays from childhood and you graduated from speech therapy. And then when you're in your work and you're trying to give presentations, you just want some extra help to get that out a little bit better. It could be that simple. Or it can be, after a stroke or a traumatic brain injury or any one of those diseases that can affect your speech, like ALS or Parkinson's, that sort of thing. There's lots and lots of avenues within those three main ones. One other one that most people don't really know that speech therapists or speech pathologists work with is with feeding issues. So
I was going to ask you about that.
Yes. So a lot, and the reason we do that is because most of the muscles used in speech, the areas in the brain that are used in speech and language development are very close to the areas that are used in feeding development because you're using the same. So that's where it kind of became part of our field or scope of practice. So that's the connection there. But we'd also work with that for kids and adults. There's a myriad of reasons you could have any number of feeding issues, and speech therapists can work with that too.
Would you say that most of your... Sorry, I didn't mean to just cut you off there.
Go ahead.
Would you say that most of your clients are children, like 75%?
I would say 75% of our clients are children.
Okay.
Some of our therapists, I really love working with all ages. So I definitely see a lot of adults too.
You're just all over. Yeah.
Yeah. I like to go all over the place. And too, it kind of depends on where you've had some experience. So I have worked exclusively with adults before. So, and then I've worked with pediatrics too. So I kind of like to do all of it. But not all therapists will see every type of client.
Yeah, exactly. That makes sense. Is there kind of a scope like you're narrowed in on certain things that you specialize in?
Yes, I really enjoy the feeding aspect of it.
Okay.
In our practice, since we don't really work out in a hospital, we do pediatric feeding because you don't need a lot of direct, access to hospital testing and that sort of thing.
Yeah.
Whereas adults with feeding issues may need more medical care for that.
Yeah.
So feeding, a lot of kids with autism have feeding issues. So that's a big connection. And then a lot of kids with just sensory issues, sensory integration issues will have feeding issues too, because your feeding system is highly reliant on sensory input. So it can make you really, really picky. So that's kind of one of my areas. I also, with adults, I absolutely love working with aphasia, which is like the loss of language after some type of brain damage or incident, like after a stroke, something like that. So those are kind of my two favorites. But I do enjoy working with all of it.
So English only, or can you do any other languages?
I would only provide therapy in English. I do know a little bit of Polish because my husband is Polish, but yeah. Don't know if you would want to be learning Polish from me. But right now it's just English. Yeah.
Bring your husband as an assistant.
Yes, exactly.
And it would help. That would be crazy if But learning another language but that's basically what you're doing though. Like you're like with these people who forgot how to form sentences or even use words or they're starting from scratch. So they're basically learning a language all over again.
Yeah. Yeah, definitely. And there's specific issues depending on where, like a stroke, depending on where in the brain you had damage, you can have specific speech issues. So like some people will understand everything, but their motor speech just doesn't come out. So they have to, which is the most frustrating one because they know
you're
exactly.
Like, it's there.
Right.
And you're like,
and cannot get it out. So
it's like you're in a dream it's like in your dream and you're yelling and nothing comes out.
Right. Yeah. I mean, you can imagine I can imagine it's like a thief in the night that comes and
Yeah.
takes your speech,
It's like, oh.
and it's a lot. Yeah. So.
Yeah, you don't really understand. It goes back to the old saying, you never know what you have until it's gone, type
Right.
of thing.
Right. Yeah. Yes.
Because,
Yep.
just thinking about that for a second, I'm like, oh, if I couldn't talk, I'm like, oh my, it'd be
Right. Well, and
rough.
think
I couldn't do
right.
anything.
Right.
I
Well,
mean,
and too, just the interaction level is cut. You like being able to express how you're feeling, what you need, what you're thinking. So it's cut on so many levels overnight that it can be really devastating to people. So, but there is help out there. There is,
yeah.
even with very
Yeah.
severe, most people can at least get some degree of improvement.
Yeah, I've
with
met
all of
people who
that.
had to learn how to talk, walk, all of it over
Yeah.
again
Mm-hmm.
from some type of tragedy or
Right.
accident, something,
Right.
brain
Right.
injuries. Yeah.
Right. That's what I tell my kids every time they go out on their bicycles to wear their helmets, or I'm going to go through every single story I have. Traumatic brain injury.
That's like my grandma when she told me never to ride a motorcycle because she worked in the ER. It's very similar to like when my grandma was like, "Don't stick your hand out the window."
Right.
I've
Yes.
I've seen so many people come in with her because they hit a pole or something happened because they had
Right.
their hand
Mm-hmm.
out the window or whatever.
Yeah.
And I remember hearing that. So
Right.
it's very similar. And the
Yeah.
helmet thing, I was a very anti-helmet kid, but I was also a
Right.
90s kid.
Right. Yeah. Me too. So.
And I was
Yeah.
just like, but now I get it. Like,
Mm-hmm.
it's, yeah. I'm like,
Yeah.
I don't want to wear a helmet. That doesn't look cool.
I know.
I want to
Right.
look
Exactly.
cool on my bike.
Yeah. No.
But
Yeah.
yeah, there's some pretty sweet
So.
helmets though that you could get.
I know, and it's much more mainstream now. Like, it's kind of,
Yeah.
nobody makes fun of you for wearing the helmet.
Yeah.
Like,
But when we were younger, people made fun of you if you were,
right.
if you wore a helmet.
So.
Like, sorry, I'm being safe. Like, being safe was like not
Right.
cool.
Exactly. Nerd. Like, now that's a compliment, which is an improvement, I think.
No, it is an improvement because I was just actually in Chicago and I was staying at a hotel in Schaumburg, and they were having a convention, a Lego convention, and I was like, I just kept cracking nerd jokes. I'm a nerd too, so I'm like, I was like,
fun.
these are different. It's a different area of nerd because I'm not a Lego nerd, but and then I found out my friend was there. I was like, of course he was. I didn't see him, but he has a Lego city in his basement, like a big whole city. Yeah.
Is he a YouTuber? My kids watch that on YouTube.
He's
with the different
Lego. I don't know how much he's kept up with that channel because he's got a lot of stuff. He's one of those guys that he just can't sit still.
Right.
He's just always doing something. So yeah, but I'll let you know if he's still doing it. I'll send it to you because he's awesome.
Yeah, definitely. Yeah, my kids love it. So
yeah, he's hilarious too. Yeah, and just a lot of energy. He is a big child.
Yeah. Well, and Legos is one of the things that I've used a lot in therapy.
Yeah.
Like just literally being able to follow the directions and build it and then like create something after, because you have to organize it and then you can explain what you made. So and the kids love it. So it is nerdy. It's great.
It's crazy how long Legos have lasted, like as something so popular, but they're useful. And it's also like, my cousin does the Lego. He gets the cheaper ones because Legos are expensive.
Right. Yes. Yes.
So he puts together like the little like flower ones and like the smaller ones, and he like just loves that. Like it allows him to focus on something,
Right. And you have like a finished product at the end. It's great.
Yeah, and you can be like proud of yourself and like it's a technically like that would be when I was doing a lot of Well, when I was working in Wisconsin, not working, but I was in Wisconsin in treatment for OCD, we did a lot of stuff for mindfulness activities. And that would be something I would consider a mindfulness activity. Anything to like shift your brain.
Right.
away
And it's
from
hands-on, and it's, We
like
actually,
you can't really think.
Oh, go ahead.
No, I wasn't going to say anything important. Go ahead.
Are you sure? I don't know if mine's important either. But with now that we're on this Lego tangent, which I love.
Yeah.
Also we used to use when we had social language groups for kids with autism tend to have a difficult time socializing.
Yeah.
So you would have groups of kids kind of matched in ages with typical peers. So kids who didn't have any social skill issues. And we would pair them together, and sometimes we would give them a Lego thing to build because they would have to talk and like communicate and share and decide to build. And it was the greatest thing ever because partly of that, it gets them in like physically touching something. So it helps alleviate some of the sensory aspect of everything going on, that focus, and then having to talk. So it's like, it's the best toy ever for, I think, anything. So
yeah. That explains why. I mean, I obviously there's going to be people that like just love Legos, the nostalgia and all that stuff.
Yeah.
But there's that whole other avenue of like, it's actually a helpful toy.
And fine motor skills, everything. I mean, it's a really good language activity for kids. As soon as they don't choke on them, hand them the Legos.
Are Legos are they a publicly traded company? I can get stock. No, I'm just kidding. Like that's when I talk about stuff like that, like shifting your focus and trying to be productive, or if you're like anxious or whatever it is. I always like to bring up the only time that I ever like there's very few times where I can shift my focus and like I'm like, oh, I didn't worry about anything for like 3 hours or whatever. But there's like there's certain things that I'm learning that like, oh, if I do this, then I'll be able to not only be somewhat productive but also be distracted, but like not in a bad way, in a good way.
Yeah, occupied.
And that's why I do stand-up. That's why I do stand-up comedy. I don't think I told you
really?
that yet. But
I'll have to look up some stuff.
I always plug it. Everybody's like, "Shut up about the comedy."
No, I love stand-up comedy. It takes guts to get out there and do stand-up comedy. I always think that.
Everybody says that. I don't know how to respond to that ever, because the only time not the only time, one of the times that I can shut off my brain and really focus on something is that, because you have to.
Right. Yeah.
Otherwise, it's like fight or flight. Like if you go off the rails, you're done. Like it's not going to go well. And everyone, and so that like it's crazy. It's just a way to like disappear for a little bit, like but you're still in reality, but you're in that you're in not disappear, you're in the moment, like you're in it. And the more you're in it, the better you do.
It's I think
wild.
Like stand-up comedy, it might be because I think a lot of comics, their brains naturally work, because good comedy is going to be like A, B, and then it all circles back around to the first idea, So I think maybe it's like if you're allowed to kind of focus on that and do it, then it would be really pleasurable. And you know what I mean? Then in real life,
they call that a callback. Yeah.
Yes, because in real life, you can't follow a thought all the way through. Not you, but I mean anybody in real life, because you got to stop and answer the phone. You got to stop and get this done. You got to
distracted.
In stand-up comedy, you get to follow it through. Interesting.
And also, like, it's cool. Like most people know, like, shut up, like, listen. So those people can just focus on what's going on, and it's a known like respect thing for the most
Yeah.
part, not to like say anything, like
Mm-hmm.
pay attention and unless
Yeah.
obviously someone like points you out. Does everybody wants to do crowd work now? Don't get me started on that, but that's like a whole thing. I, if I ever
Yeah.
meet Matt Rife, I'm gonna argue with him for like a good amount of time. But I love that
Right.
guy. But man, did he mess things up when it comes to that. Like people expect like
No,
crowd
it's
work and stuff
expected.
now.
Mm-hmm.
Yeah, people don't expect it from me because the moment I get on stage and I start talking, they're like, yeah, this guy's not a crowd work guy. I'm like, no, I'm not. I'm an observational
Yeah.
comedian.
Yes.
Um, and I may say
It's
something to somebody to help with my joke or something, but like,
right.
not typically. I'm not like, where are you from? What are you doing? Like,
Right. Yeah.
I don't know
Yeah.
it, but I could talk about that forever. So let's steer back a little bit. So what are some of the most common like disorders, if that's the right word to use,
Mhm.
in your practice that you see the majority of the time? That's more
Mhm.
like not trendy, but like just
Yeah.
something more common.
What you see, right. So one of them is, of course, autism or
Hmm.
neurodiversity, is one that we see. Um, and then one that a big one is obviously delayed language. So like 3, 4 year olds who just kind of aren't meeting their milestones exactly where they need to. Um, Sometimes that's just a true delay, and then once they get in and they have therapy, they're good to go, and everything else just kinda starts happening, and they're fine, don't need any
Hmm.
intervention. And sometimes it's more of a true language issue where, like, they're probably gonna need some help along the way, moving forward. So we see that a lot. We see a lot of speech sounds, so kiddos who aren't saying their R sounds correct, or
Yeah,
sometimes more severe where, like, you can't understand a word that the four-year-old is saying.
yeah.
That's yeah. So we see a lot of that. And then, of course, with adults, we see aphasia, which is after any kind of brain damage. So
Mm.
after, like we talked about, strokes is a big one. A lot of younger people are having strokes now. The numbers are
Ooh.
way up. Yeah, which is unfortunate, obviously. But a lot of younger people are having increased aphasia because of increased strokes.
What do you
Um,
think's causing this increased strokes? What's your theory?
yes. So my
Theory.
theory, yeah. So this is yeah. I'll definitely put this out there that it's a theory. Um,
Yes,
I think it's kind of there's a lot of controversy on it. I think
that's
it's
fine.
a combination of a lot of things. I think more women numbers are going way up, and I think that's
Ooh,
part of right. I think that's especially African American or Black women way up.
way up.
Um,
Okay.
yeah, and part of that is because they're just historically they have more risk factors for it, like hypertension
Yeah.
is just higher numbers than Black versus white women or men. Um, but also women, the same reason that their numbers are so high in heart attacks and all these other areas too, because they tend to get understudied and underserved. So part of it is that more of them are, having the strokes younger because they didn't recognize the symptoms. So by the
Mm.
time they have these symptoms, they haven't had any preventative measures. Whereas men tend to have more obvious symptoms and they tend to not
Oh,
write off their symptoms. So women tend to write off, well, I guess it's just because I'm going through menopause, or I get that's a big one. Or,
yeah.
oh, I'm just stressed, or I'm busy, or oh, I just had a baby, or oh, this, that. It's just
Yeah.
historically women tend to write off their symptoms, whereas men
You
tend to
could
not.
just like you could put it. Oh yeah,
Yeah,
that's
put it
fine.
off. And women have milder symptoms. So,
Ooh,
um,
yeah.
yeah,
Sneaks
so
up
like,
on you.
yeah, exactly. So I think there's part of that. There's also people's theory about like the diet, more processed foods,
Yeah.
more, all those things, more obesity, all the stuff that's probably factors in all of it.
Factors.
Um,
Yeah.
but yeah, there's a million factors in it, but the numbers are really going up, which is unfortunate.
Yeah, that is
So,
wild.
yeah. And most of the studies, because historically strokes happen in older people, are done on much older brains. So it's really hard to take that information and apply it to a 45-year-old, because a 45-year-old brain is a whole lot different than an 85-year-old brain.
Oh, yeah,
So,
absolutely.
so the research gap is huge there too, if that makes sense.
So yeah, we were talking about the increase in strokes and
Mhm,
kind of why that might be, and signs and symptoms. Like you said, there was some. I don't know how much you know about this. But
mhm,
as far as when it comes to strokes, you said women have symptoms that they don't really notice or they write off. What do you know
mhm.
of what some of those are?
Yeah, so some of the symptoms of stroke for women that women tend to miss is
Yeah.
lightheadedness, dizziness, just faintness feeling. That's a big sign of it. Oftentimes you'll have a little bit of numbness or facial sided weakness or drooping, but unless it's really significant, they'll write it off as, oh, I'm allergic to some new medication, or,
Yeah.
that sort of thing. Whereas typically, just historically, if men realize that, they're just going to go into the doctor, or they're going to go tell somebody. And they're going to
Like,
say, okay,
this is
that's
a
not
problem.
normal. Let's get this fixed. Right. Exactly. Women tend to push it off. So, unless it's a lot of those symptoms aren't really painful. So, you think of like a stroke as being like, oh, you pass out or there's a lot of pain involved in it. A lot of times there isn't. So, it's not a
Mm.
huge amount of pain. It's more of these subtle symptoms that could be other things, but a lot of times they're symptoms of a stroke. Um, so those are some of the subtle things. Heart, like arrhythmia, that sort of thing. They tend to think, oh, I'm stressed out, or oh, I need to take a rest, or
Yeah.
I've been up all night with the baby, so I'm not gonna. Of course, I'm feeling this way. That sort of thing. So those are some of the simple signs of it um, that tend to get missed. I would always say if there's ever any numbness or like dizziness to the point that doesn't resolve within like 2 or 3 minutes or isn't obvious as to why you're feeling dizzy, I would always either go to the ER, but always at least call your doctor for those if you're female, because those are very subtle signs that can turn quickly. And with stroke, it's a race against time, depending on how much damage there is. So even more so than any other issue, heart attacks, any of that stuff, a stroke is a race against time. So the quicker you're in and they have you in treatment during a stroke, the much lower your risk of severe damage is. So wait and see is never good with stroke symptoms.
No,
Yeah.
that makes sense.
Right.
It's
So,
it's funny. Well, kind of funny, not really, but it's funny that you brought that up about like women just writing things off. I grew up
mhm.
around men who wrote everything off, like
Oh, really?
oh
Yeah.
yeah, maybe not stroke stuff, but like just anything like
Right.
I do
That's
it
true.
all the time. I
Right.
do it all
Yeah.
the
I
time.
think everybody would do it.
The
Yeah.
I'm fine, the old like I'm a man, I'm fine, that kind
Right.
of
I'm
thing.
not going to the doctor. Yeah. I
Yeah,
think
like
part of it, I think the difference with women is that, and I don't mean this like men don't do this. I don't mean it that way at all. But I
that's
think the
fine.
difference is that they're very focused on everyone around them versus themselves. So,
Yes.
especially moms, like, oh, well, I'm feeling this, but I've still got to take the kid here. I've still got to get him to practice. I've still got to make
Yeah.
dinner. I've still got to do this. Whereas I think that's part of it. Not that men don't have anything to do. I don't mean it that way at all.
We're
But
just hanging out. Yeah.
yeah, right. So but I think that's part of it is they push it off and then the symptoms are gone, so they don't think anything of it. And
Yeah,
then
absolutely.
by the time it's big enough to get them into the doctor, it's farther in. So, you know,
It's a yeah, it's ticking
um
time bomb.
also one of the things too is that a lot of the like precursors that put you at, not necessarily precursors, but things that increase your risk, like hypertension, those are
Pre-existing
notoriously
conditions.
yeah, yeah, those are notoriously underdiagnosed in women versus men because they have to do with the heart, and almost 99% of the studies historically have been on men. So
Really?
now they're finding this big gap between how heart problems aren't diagnosed well in women because we have no studies on them, and the symptoms are different in women versus men. And then, so you could see how it's missed. And then also the treatment is not working on women like it does for men because it's not geared towards women. So
Gotcha.
part of it's that because heart issues will put you at a much higher risk of stroke. So it's partly tied to that, which has always historically been done with men, which is interesting because it's the number one cause of death in women is heart, which is fascinating. That why wouldn't it be studied more? But it's just not
interesting.
Yeah. So they're getting better with that. They're starting to open up the research a little bit more, but it's still just light years behind.
I feel like I don't feel like that was like totally intentional though.
No.
Because I feel like there was a lot of issues that women had more than men and vice versa. So they would focus on that, like breast cancer, for example. Like,
right. Yeah.
Men can get breast cancer, but it's more common for women.
Yeah. Well, and I think too, there was more men diagnosed with it. So it appeared to be more of a male problem. Yeah. And it's also, which I found this was interesting, but it's also notoriously harder to get women to be parts of medical trials than men.
Oh.
Yeah.
Okay.
So I don't necessarily think it was, I think it's an oversight because you have to get both, obviously. But I don't think it was, we're only going to test men. I don't necessarily think it was all that.
I don't think this is a patriarchy problem.
Right.
Like,
no,
I
think it's more of, I think it's more of just, this is how it turned out.
Yeah.
But unfortunately, this is what's happening because of it. So we need to fix it at this point.
Yeah. You got to pivot. You got to adjust.
Yeah.
Because you only know what you know. Exactly.
Right.
Like, it's same thing when it comes to like smoking cigarettes. Like everybody smoked cigarettes like in the 50s or 40s.
Right.
And like they like advertised them like just like it was no big deal.
Yeah.
And then everybody started getting lung cancer. Like, we should probably,
maybe this isn't correct. Right.
Yeah, maybe this isn't correct.
Right.
Or if you're like my grandpa, like the cigarettes got too expensive, so he stopped smoking because of that reason.
Right.
He's just principle.
Exactly. Yeah.
I
guess hindsight is always a little bit better.
I'm like, man, I know people, if cigarettes are $20 a pack, they're still smoking.
Right. I was out just this Thursday night with my friends who were two ex-smokers, but when we go out, they always want to look for the cigarettes. And they were like, and these are grown women with salaries and they can afford $20 cigarettes. But they were saying too, they were like, I'm not paying that much money for cigarettes. And then they talk back in the day, we could get them, for whatever, $2.99, so whatever. Yeah. It's funny.
For some people, that's like getting gas. They're going to pay it.
Right. Right. Yeah. Yeah.
I'm so glad. Like I've had background issues with addiction and things like that, but I'm so glad that was not something that didn't ever take or stick or like, because
it'd be hard to stop. I think. Yeah.
And I'd probably be vaping. We don't even know about that. We do a little bit. But get popcorn along and like people like reaching for their vape like all the time.
Yeah, it's a lot. My brother has always smoked. It's interesting too with smoking, this on a tangent, so tell me to get off if I need to. But it's interesting because my brother and I were 4 years apart. All my relatives smoked. My parents didn't, but all my relatives smoked. So my brother was always interested in it, like always wanting to like grab a cigarette, go like, and I just never was. And it wasn't because I thought it was terrible. I was just never interested, but he was, and he's still to this day is a chain smoker, and he's always, and then he switched to vaping and then went back, and it's just interesting how from that young, he was hooked, like wanted it already at that age,
Well, he saw other people doing it. He thought it was cool.
Yeah, I thought it was cool, right? Yeah, and then by the time you're old enough to know better, you're actually a smoker, so it's tough.
Yeah. You're old enough to know better, but you don't want to miss out.
Right, right.
You're like,
Right. It's funny too, because my 9-year-old just figured out that his uncle's my brother smokes. And the reason he figured out is because he actually thought my brother will always say, like, "Oh, I'm gonna go to the car," because he'd want to tell the kids I'm going to smoke a cigarette. So he'd go to the car and smoke a cigarette by the car. Well, my 9-year-old followed him for the first time and was
yeah,
like, "That's what a cigarette smells like?" He just thought it was my brother's smell. Like, he had no idea it was
like his
cigarettes.
scent.
Right? It smells like him. So, anyway, I
he
thought it
just
was funny, but yeah.
he just sleeps in a bed of marbles.
Right,
Like,
right. He's a cowboy.
yeah.
Right. But he was dead. Like, that was the first time he ever put it together, but that was what a cigarette smelled like, which means he's never smelled them before, which is insane. He's 9. Who
Like
knows?
just walking around, like, but you don't see it like
Yeah, I
as
guess
much.
in his
The
little
only time you
world, you've
really
never seen it.
like during the day, like when you're walking around, it depends on where you're at. It really
Uh-huh.
does. Like in bigger cities, you're gonna see it.
Yeah,
Like
yeah.
when I was in New York, I actually smelled weed more than I did anything else.
Yeah,
Uh,
they know what that smells like because you get on anywhere, you could smell that. They know that, but he had no idea what a cigarette smelled like.
I'm pretty sure my parents were just like, "That's a skunk."
Right, right,
that's
right.
that's that's
Yeah,
probably
they
what they
teach them
did.
that in school now and in Boy Scouts. They teach
What?
them, or they did for my boys, all 3 of them. They taught them early in Boy Scouts that that's what those smells are, which is interesting, right? So they teach you, you'd think like, is that too young? But he knows what it smells like.
I
So
mean,
apparently they didn't teach him cigarettes, but
yeah. Well,
I don't know.
it's not as common.
Right. Yeah.
And now it's getting legal everybody everywhere,
Right.
and
Yeah.
everybody's just like having a field day with it.
Yeah.
I don't.
Yeah.
I don't. You're in North Carolina. I don't
In
think it's
North
legal
Carolina,
there.
no, it's not legal here yet that I know of, but in Virginia it is.
So
Yeah.
people just go to yeah. That's the
Well,
thing. Like
medically. Oh.
I live by Illinois, and I'm on the border
Hmm.
of Iowa and Illinois. Like literally, people can just drive across the river and
Yeah.
recreationally buy weed,
Oh,
and
yeah.
yeah,
Yeah.
it's
Yeah.
crazy.
Yeah.
You would,
But I mean, it's here because you can, I mean, it smells like it's legal here, like everywhere you go. So,
oh yeah,
yeah.
and honestly,
Yeah.
yeah, it's just one of those things.
Yeah.
It's like, all right,
Yeah.
whatever.
Yeah.
Some people have their opinions on it. I don't really care as
Yeah.
long as you're not affecting me.
Right.
The smell is kind of annoying sometimes. Like I get it. Like people don't want to
Hmm.
smell that. People don't want to. I would rather smell that than cigarettes, though, personally.
Yeah.
But um,
Yeah. The cigarette smell is just um, yeah, it's just such a noxious kind of smell to me. But,
I don't hate it. Um,
yeah.
it doesn't really bother me. Like I hang out with
Yeah.
comedians.
Yeah.
Comedians are old school. They're drinking
Yeah.
a Budweiser, smoking a cigarette. Like that's gonna be
Right. Right.
like,
It's going to happen. Yeah.
yeah, you're gonna have that, and I'm just like, yeah.
Yeah.
And some of them have done the vaping and switched back,
Yeah. Hmm.
but I want to shift gears a little bit.
Yep.
I wanted to ask you a question. This is a super random question, but I wanted to ask you,
Okay.
when it comes to like communication in general, this is just something that I have observed a lot, and I think everybody else was noticing it too. But do you
Hmm.
find that like with social media and like the tablet culture and online interacting, you feel like that is causing issues with communications in kids?
Do you mean like social issues or like grammar issues, that kind of thing?
Social.
Social, right. Um, yes and no. I think it's
Yes
part
or no?
of, yeah, I think for the positive aspect of it, I think it's the norm for them. So,
Yeah.
not that I'm saying it
Yeah.
should be the norm. I'm not even getting into
Yeah.
that, but I
Their norm
feel
is
like,
their norm is
right,
different than ours. Yeah.
right. It's normal for them to communicate to people through the screen and all that stuff. So I do think the younger children communicate pretty typically through a screen, even like compared to how they talk like in person. So like the 9, 10, 11-year-olds, their on-screen communication is similar, although they're a little bit too young to be doing a lot of that, but in my opinion, but it's similar
Yeah.
to how they would talk to them in person. There's not a huge difference yet because cognitively they're not able to make that distinction, if that makes sense, language-wise. But then when you get into the teen years, I think it definitely has the potential to harm it because you don't have to take into account anybody's feelings or facial expressions sometimes, or it's just easy to hide behind that. So I think it's easier to have a lack of empathy with people as a teenager when you can say it to a screen. Because it takes guts
Oh
to
yeah.
say something to somebody's face. You have to look at
Oh
their
yeah.
reaction. You have to feel their pain or their upset. You don't with a screen. So I think it does take away some of that feedback that they would get in a face-to-face interaction, if that makes sense. And I think that's
Yeah.
detrimental. So, that's where I feel like it would make the most difference is that. And I feel like there's increased anxiety in face-to-face communication because they're not
Yes.
used to it as much. And I don't
I
think
agree.
increased anxiety is ever a good thing.
No.
So I feel like, and it makes sense. Why wouldn't there be anxiety? You're not ever used to doing that. And it's because you don't have to deal with their reaction. You can separate yourself on a screen. So you're not really communicating because you're not really having to deal with that other person's reaction or feelings or thoughts about it. You know,
Exactly.
so
Yeah.
that's kind of my, I'm sorry. Yeah. So what's your opinion on it? What do you
My
think?
opinion on it is that my thing is I grew up with the internet. I mean, I
Mm-hmm.
like as it evolved into what it is today. My biggest thing is people not understanding context
Mm-hmm.
of things.
Right.
Um,
Mm-hmm.
like I could post something, on, I've been using one of the things I've noticed that I've gotten a lot of crap is on Threads. Um,
Uh-huh.
the Facebook, Instagram, whatever meta version of basically Twitter.
Uh-huh.
And it gets pretty ruthless on there, and people have, and even Instagram, like I've commented on. I commented on another comedian's post,
Uh-huh.
like playing off of their caption and making a
Uh-huh.
joke, and it got
Uh-huh.
took in the wrong way, and I just got
Right.
roasted, and I was just
Right.
like, "What?"
And then
Like,
it's like a beast of its own because you
and I'm
can't,
like,
it's like the telephone game,
yeah, it's like
back in the
if I
day.
would have said that, if you were standing right next to me in person, and this person knows me in person too, but not that
Mm-hmm.
well, but I guess I'll give them
Right.
that.
Right.
But they tag my job and try to get me
Mm-hmm.
fired from my job. It's insane. Like
Right.
that kind of
Yeah.
stuff. That is
Yeah.
really frustrating, and it's like,
Right.
just have a conversation with somebody, just talk to them,
Right. Right.
and figure it
Well,
out.
and
Most people
yeah,
understand.
I think too, it just seems so, I think two things with that. That's my professional opinion. I feel like
Yeah,
that goes back to that no feedback. They don't have to deal with any of it. So they
yeah.
can write whatever they want. They don't have to deal with, oh,
There's no
maybe I didn't
consequences.
take that into context. There's no like back and forth. There's no, and then they can look like the big man, like, I'm going to go report this here because this is terrible. So it's all just accolades for themselves. But like, where's the communication there? You're just doing this to advertise yourself. You know what I mean? Like,
Yeah,
there's not a communication involved in it. It's just, what's that movie, Fight Club, where they talk about how some people don't listen, they just wait for their turn to speak. That's
yeah,
what it reminds me of. Like, there's no critical thinking involved in that at all. Like, to me, which is upsetting, I think.
yeah.
But,
I've
you
also
know,
noticed it's harder. Not all kids, but to have a conversation, like a long conversation. I'm not
mhm,
I'm not talking like just a
right.
little interaction,
Yeah.
but
Mhm,
having like an act, like I'm
mhm,
talking like sit down face to face and have a
Yeah.
conversation for 30 minutes
Yeah. It's
without
that like immediate.
without this
Yeah. Yeah.
and other distractions and just talking like we are right now.
Yeah.
I feel like there's just so many distractions and also the anxiety, the social anxiety, because they're not used to doing that as much.
Right.
Because they don't have to.
Right.
Yeah, I was talking to somebody the other day that, they like, because I don't have kids of my own, so I have to just like ask questions and learn from other people.
Right.
And so a big issue that, not issue, but like one of the, it's like a culture, just their thing is like, they don't go hang out at each other's houses.
Right.
Like we used to do that.
Right.
That's all what we did.
Yeah.
They'll go home and get online and be on like Discord or wherever,
Right.
talking to each other, and it's just very interesting. And I sound like an old man. I sound like an old man where I'm like, ah. And
they're kids these days. But it's interesting because I have 3 boys, and one's Gen Z. So I have a 22-year-old, so he's Gen Z, and I feel so he was in high school during COVID, and so I do think, for a lot of reasons, I do think that affected that sort of, because they had to do everything on a screen for years. But and two, I think that was the generation that grew up with not a whole lot of like parents restricting phones.
Yeah.
Whereas I think that was, but that's just my opinion on stuff. But so it's interesting because his generation, they rarely went to each other's houses. They like a lot of his friends didn't care if they had a driver's license. Like, what? Like, I was all about getting a driver's license. I didn't want to be at home and doing stuff. I wanted to go out and be with my friends. And that wasn't just him. It was a lot of Gen Z kids that I knew. And then it's interesting because then I have a 13-year-old and a 9-year-old. So they're, what is that, Gen Alpha? I'm so old, I don't even know the generations anymore. I think it's Gen Alpha. And granted, they're younger, but they
Which
want
sounds
to be
awesome,
with friends.
by the way.
Right, it does. It does.
Sounds super cool, but
right, it does. Yeah. So is the next one like Gen Omega? No, I don't. Or Gen Beta.
That's good.
Anyway, I think it sounds more awesome. But anyway, so my younger ones, and granted they're younger, and everybody's personality. I know this is anecdotal, but all those kids want to be together all the time, like physically together. So it's
really
interesting. Yeah. So I think there's a little bit maybe of a difference between Gen Z, and there's also much more, like this time around with these younger kids, there's much more phone regulation by parents than there were when my oldest one was. So who knows? I mean, that's not scientific at all, but
so
I've seen that difference a little bit.
Gen Z is more of the tablet kids, I guess.
I think so, because they were teenagers and they were teenagers in COVID. They weren't allowed to go out and see people. They didn't have and that, I mean, so I think part of that. Yeah,
that's like a crucial time.
Yeah. So it's interesting, all that, but we'll see how it pans out.
I had thought about that when I was like, when COVID was going on, I was like, what would I be like if I was still in school right now? Like, how would I be handling this? I'm like, I tried not to think about it too much because I could go down a rabbit hole, but I'm glad I didn't have to deal with it.
Yeah, and I think it's different personalities too, because my 22-year-old hated going to school. Like, he hated school. So to him, he was like, awesome. Like, I can stay home and do it, like
I would agree with that.
Yeah. Whereas my younger ones, even though they complain about school, they would miss the aspect of going. But my oldest one was like, awesome. So
sweet.
I know for me, it was a nightmare as a parent having a high schooler.
I bet.
And during COVID, and I had to look at, like, there was a different website for every class, and I was like, I can't keep up with all of this.
It's too much.
Yeah. But
she's like, I'm just going to start homeschooling. We're done.
Oh, I basically was homeschooling. So,
I've heard that story from multiple people.
Working full time. Yeah.
Yeah.
So, yeah. Sometimes.
Yeah, the teachers can only do so much.
Yeah. Yeah. Yeah.
Because, I see both sides of it. My sister's a teacher, and my God.
Yeah, it wasn't the teachers.
She's a second grade teacher. It's like...
And they were on Zoom all day. It was rough. It was rough. I get a little PTSD thinking about it.
Oh, yeah. Yeah.
So, yeah.
Yeah, I don't know if that would have lasted longer. I don't know what she would have done, because she's a very in-person, interactive person. Like, that's what...
Right, teaching and all that stuff, most of those people are, or else you wouldn't be in that field, so...
Oh, yeah, she's natural. Yeah.
Yep.
She has good amount of patience. I have the patience, and I have a lot of the aspects where I could probably be good at it, but I'm also like, I don't know if that's my path. My path is probably going back to school, getting my degree. I already have not a master's, a bachelor's, but it's in marketing. But I want to go back to school for psychology. Just because I think therapy makes the most sense for me. And I couldn't. That's the way I want to help people. That's the I respect the shit out of teachers, but I'm just like, no way.
Yeah.
Not doing that.
It's a lot.
Especially and karma. Just to say, I was not the greatest student, so I would I would get a lot of it would be bad, especially if it's high school. Ooh. I was you didn't want me in your class in high school. It was everything was a joke. Everything was a joke.
Yeah. Well, at least you were talking.
True. I was talking.
You were still communicating.
Not when they wanted me to.
Right. Humor is a big sign of intelligence, though. For real, if my kiddos who are coming in who aren't talking at all, and so of course they're testing. Sometimes it's tough to test a kiddo who's not talking, because a 2-year-old doesn't care what you know about them, so they're not going to perform, and it's really hard to get an accurate reading of anybody's brain, what they actually understand, but especially if they're not talking and they don't care that you're there. So a 2-year-old. But I'm always, if you're playing, if they're making little jokes with the toys, like obviously they can't speak, but I'm not worried about their IQ, because it takes a high IQ to have humor. It does. It's a very high level language activity. So
I'm not going to tell any of my comedian friends that, by the way.
Yes, you need to tell them.
I'm not going to tell them.
But it is. So,
now,
maybe some exceptions.
I don't want it to go to their head. I just don't.
Yeah. Literally. Yeah.
Yeah, literally.
But it's true. Like I'm definitely, and also too with that, like if they're trying to get out of doing stuff, their brain's working. Because they know what I'm trying to get them to do, and they're like, no, and they're trying to do something else. I'm not worried about their IQ level, if that makes sense. Still got to work on their speech and language, but I'm not worried that this child has got something else going on.
Yeah, I feel like that reminded me of my therapist, because she doesn't get frustrated, but she just knows by now. Like, she knows that I am not. I don't know what my IQ is, but I'm not low IQ. Are you still there?
AirPods again, randomly.
That's fun.
But I'm here. I heard all of it. So I'm good.
But what was I saying? She has an issue with not an issue, but she always calls me out and says that she goes, yeah, I'm going to tell you this, but I know you're not going to necessarily do it anyway.
Right.
But I'm just going to tell you this.
Right.
She's like, I already know I can't tell you what to do.
Right. Yeah.
And I'm like,
it's good to know your audience.
It's good to know your audience, but she can advise me. And like, I take suggestions. I don't, that's one thing that I have learned over the last like probably 10 years is like when you're working with somebody is guiding them and giving them direction and offering insight or just even listening is more important than telling somebody what to do.
Yeah. Yeah. 100%. I think
unless they're like, hey,
tell me
what
to
do.
Right.
Yeah.
Right. Yeah.
Yeah.
They need
Unless
some,
I say that, like, hey,
yeah.
I'm stuck. I need
Right.
advisement,
Yeah.
that, and I could be like that too.
Yeah. Yeah.
But let me actually say that before you just start giving me a bunch of things.
Yeah.
That your camera's off for some reason.
Oh. Uh-oh. Why is my camera on? I don't know. It's showing me on here. Let me see.
Weird.
I see camera. I don't. It's like it's not letting me do anything. I'm trying.
We're pretty much at time anyway, so it's not a big deal.
You sure? Okay.
Most of the listeners are audio only anyway.
Right.
I really only do video for like posting clips and stuff like that.
Right. Okay.
Because some people watch it on YouTube, but not very many. It's mostly
yeah.
My listeners are mostly on Apple Podcasts. Like,
okay, that's good. I don't like my face on film anyway, so I'm good.
I've gotten that. I've gotten it from a lot.
I don't
lot
mind
of people.
if it's out there, but I'm still like, whenever the Zoom comes on, I'm like, oh, who is that?
Who is that?
Me.
Yeah,
right. It's not me.
There's no way. Yeah, I get what you're saying. I've gotten so used to it doesn't even matter anymore. Like, it's just
yeah.
Camera being recorded. Honestly, like I can almost function better sometimes when I'm being recorded.
Yeah,
it's weird.
It's your comfort level. Yeah,
I can like get in that zone if I need to.
Yeah.
But yeah, I wanted to wrap things up. But I appreciate you taking the time to talk to me today. I feel like we had a good conversation. We went on a few rants, which
it's been fun.
Totally fine.
Yes.
So yeah, tell us a little bit about like where people can find you, or if you have any nuggets of information for anyone who may need services like that you offer. Obviously not everyone's in Charlotte, North Carolina, and can just stop by, but you're not the only person doing this, but or if there's like a recommendation, like is there some type of a good way to find somebody that really knows what they're doing? Like, say I'm in Iowa and I'm not going to be going to Charlotte anytime soon, so I need to find somebody in my area. Is there like a good site or a resource to use to find somebody?
Yes. So the best resource. Well, first of all, we're in Charlotte, North Carolina. But if you need to find somebody in any state, because all speech therapists have to be licensed within a certain state to see, even if you're doing telehealth, you have to be licensed in that state. So one place that I always tell people to go is called ASHA. It's ASHA.org. It's American Speech and Hearing Association. And if you go on that website, it's pretty easy to navigate, and it'll pull up speech therapists licensed speech pathologists who work in certain areas in certain states. So it's an easy search and find, and that's the national identifier. So if they're on that site, it's a legit person.
Nice.
So that would be one thing that I would recommend. I would also recommend, if your insurance for whatever diagnosis, whether it's a child or an adult, private insurance, Medicare, Medicaid, all cover forms of speech therapy. But if your plan does not cover it, it does not necessarily mean that you would not benefit from it. So just because your insurance plan does not cover it, ask the people that you're looking into if they would still recommend it. And if they would, what is their private pay rate? Because sometimes those are very affordable. And oftentimes insurance covers portions, but not all of it. Especially with adults, they cut you off pretty quick. And there's still all the studies show that there are lots of improvements to be made after insurance cuts you off. So don't feel like if that's the case, you couldn't still benefit from therapy. And sometimes there are options and grants or, different things that are more affordable than you think they are. So it's definitely something to pursue. Yeah, but that's kind of
cool,
all my little nuggets.
Yeah, that's good information because when I got out of treatment, when I did OCD treatment, residential, and even when I did the outpatient, they were like, I was like, I need to find a therapist. They're like, use, the International OCD Foundation website,
right?
Because you have to be certified to be on there,
right?
Rather than just doing a Google search because you never know.
Yes, yeah, right. Yeah, and hopefully everybody's legit, but everybody on that site has to be because you have to update it all the time.
Yeah.
Yes.
Oh, and you have to do certain credentials and things like that.
Right. Yeah, it shows if you're licensed. If your license is expired, they kick you off of it. So
nice.
It's definitely it's the first place you got to make sure you've got all your stuff to get on there. So
that's good.
Yeah.
Yeah, it's good there's stuff out there because the internet can still be the Wild West.
Exactly.
So
yes,
you never know.
Yeah.
Well, Ashley, I appreciate you taking the time today, and hopefully at some point I will end up in Charlotte and we can have coffee sometime.
Yeah, definitely.
Find me a comedy gig there, and then I'll be there.
I will. We do go to the Comedy Zone a lot.
Nice. Comedy Zone.
Yeah, that's right.
Nice.
Yeah.
It's a good name.
You can't pick us out in the crowd though. Can't do the crowd
work.
I don't.
No.
I'm kidding.
Unless you say something, then it's fair game.
They do always pick my blonde-haired Polish husband out as the white guy in the crowd every time. So
he stands out. Yeah.
Yes.
Is he a big guy? Is he tall?
No, he's actually just about an inch or so higher than me. So he's not but he is very clean cut, So they usually pick him to make a corporate joke about.
Oh yeah.
So,
so corporate white guy joke.
Yeah. Yes, exactly. So about some meeting he's late to, something along those lines. Pretty funny. He takes it well.
That's good.
So yes.
That's good. Yeah, if you're going to a show, you got to be able to handle it. Otherwise,
yeah, right.
What are you doing? What are you doing there?
Yeah, I'm glad they focus on him and not me. So
yeah, that's always nice too. Yeah, it's fun for you.
It works. Yeah.
All right. Well, I'm going to stop the recording here.
Okie dokie.